The prospect for enhancing motor skill learning is exhilarating for practitioners in sports, rehabilitation, and physical education. Accordingly, when implicit learning interventions were proposed in handbooks of coaching and sports psychology as alternative to traditional explicit instruction-based learning methods, these were readily adopted in sports practice. The more traditional methods presume that motor learning necessarily progresses from an initial verbal cognitive phase, during which a learner gains declarative knowledge about the technicalities of movement skill to increase performance, to a final autonomous phase, in which the skill has become an automatized, procedural routine and the learner is barely aware of movement execution. This mode of learning is generally referred to as explicit learning. By contrast, implicit learning methods take a starting point that such an initial cognitive phase of declarative knowledge accrual is not mandatory. Instead, motor skill acquisition would involve direct accumulation of procedural knowledge, which is inaccessible for consciousness and is not dependent on working memory processing. Learners generally are unable to verbally describe the technicalities of the skill. Thus, motor skills that are learned implicitly are thought to be less reliant on declarative knowledge compared to skills that are learned explicitly, and instead more strongly capitalize on automatic processes. In other words, after implicit learning, motor control should be characterized by a greater degree of automaticity or, since they are two sides of the same coin, by reduced conscious control. This should be particularly evident in early learning, given that with protracted practice also explicit motor learning should eventually culminate in automatized motor control. Methods. Experimental design. Studies were included if they compared the effects of an implicit with an explicit motor learning intervention on motor task performance in single and dual task conditions on separate retention tests. Such tests are imperative to determine whether an intervention has any lasting effect on motor performance and automaticity. In motor learning literature, retention tests often refer to single-task motor performance assessments, while dual-task assessments are generally referred to as transfer tests. In this review, we use the terms retention tests at retention to indicate the point in time that assessments took place, rather than the type of assessment. We distinguish between studies with immediate, 24H, and delayed, 24H, retention tests. Implicit and explicit motor learning interventions. Studies were included if they compared explicit and implicit motor learning interventions. This review followed the definitions outlined by a recent Delphi study, which we also used in an earlier review on implicit motor learning post-stroke. As such, implicit and explicit motor learning are thus not necessarily considered to be separate processes, but rather as two ends of a continuum, with purely implicit motor learning on one end and purely explicit motor learning on the other end. In sports practice, it will be difficult to induce pure implicit motor learning, as athletes will always have some awareness and verbal knowledge of their performance. Yet, interventions may lead to relatively more implicit learning when they actively minimize athletes' use of explicit declarative knowledge to improve their performance. Hence, the following motor learning interventions were labeled as implicit: analogy learning, providing the learner with a metaphorical instruction that summarizes the global structure of the skill, and consequently only requires minimal conscious processing on the part of the learner. For example, for basketball free throws, shoot as if you are trying to put cookies into a cookie jar on a high shelf. Errorless or error-reduced learning, minimizing errors during practice. For example, initially practice golf putting at close range, and then gradually increase putting distance. The idea is that when no, or few, errors occur, the learner will not be enticed to test hypotheses how to improve performance, which is a highly cognitively demanding strategy. Dual task learning, performing a concurrent attention-demanding secondary task during practice. A concurrent secondary task utilizes working memory capacity, thereby restricting a learner's opportunity to consciously control his or her movements. External focus learning. The idea is that when learners focus attention on movement effects goals, this reduces interference of normal automatic, implicit, motor control compared to when they focus attention internally on the body and biomechanics of movement. For example, for dart throwing, focusing on the flight of the dart or the bullseye, rather than on the movements of the hand. In contrast, verbal explicit instructions that describe how the participant should perform the movement, errorful learning, trial and error learning, and internal focus learning, where the learner is instructed to focus on movement execution itself, were considered to be explicit motor learning strategies. So-called discovery learning interventions were only included as an explicit intervention if learners were explicitly instructed to actively search rules of movement. Types of motor tasks. Classical studies into implicit motor learning have focused on the sequencing processes underlying motor learning, by having participants learn a sequence of button presses, the serial reaction time. Learning sports-related tasks, however, typically requires one to acquire and optimize the dynamics of movement rather than to master the appropriate sequence of movement. Therefore, we only included studies in which participants needed to learn tasks with relatively complex movement dynamics. Outcome measures. In order to make a consistent comparison between learning interventions, we only focused on dual task performance measures. The degree of automaticity of movement was operationalized as motor dual task performance after practice was completed. Two aspects of dual task performance were assessed: 1. Absolute motor performance in dual task conditions, and 2. The robustness of motor performance to dual task interference. Results. The figure shows the flow of study selection. The search yielded a total of 4,125 single hits. Screening for title and abstract resulted in the identification of 119 possibly relevant reports. However, a majority of these reports was excluded after full text screening because they did not make a comparison between implicit and explicit learning interventions, or lacked dual task assessment at retention. 9 other studies were excluded because they did not investigate a sports-relevant, motor, task. Eventually, 25 studies were included in this systematic review. Several studies described multiple experiments, retention tests, or intervention groups. We evaluated these separately, such that our review includes a total of 39 implicit-explicit motor learning comparisons, 29 concern comparisons on immediate retention tests, and 10 concern comparisons on delayed retention tests. The possibility of publication bias was explored by means of a funnel plot. Study characteristics. The table provides a detailed overview of each study's characteristics. 25 randomized controlled trials were included, totaling 1040 participants. Most studies concerned young adults, who were novice with respect to the motor task they needed to learn. 20 of the 25 studies explicitly state that participants had no prior experience. 5 studies do not describe participants' experience. Overall, the majority of studies involved small sample sizes. Practice durations varied from 1 day to 6 weeks, while subsequent retention interval ranged from 5 minutes to 2 weeks. The types of motor tasks investigated included golf tasks, table tennis tasks, balance board tasks, basketball free throws, rugby passing, miscellaneous aiming throwing tasks, and a surgical task and pedalo riding. Dual task assessments at retention mostly consisted of counting tasks. Both backward counting and tone counting were frequently tested. Other studies used variants of probe reaction tasks or had participants generate random digits, letters, or sequences thereof. Only one study explicitly mentioned that participants had to prioritize motor task performance over secondary cognitive task performance. Risk of bias assessment. The risk of bias assessment was performed separately for each experiment. In this section, we therefore refer to experiments, rather than studies. The figure provides an overview of biases per domain per experiment. Overall, experiments exhibited an unclear risk of bias. This was predominantly due to a significant lack of reporting. For instance, no detailed descriptions were available of randomization procedures and blinding of researchers, participants, and outcome assessor, nor were any study protocols available to assess reporting bias. Further, only 5 experiments reported on the number of dropouts in the experiment. Of these, 2 experiments scored a high risk of so-called attrition bias, due to a dropout rate of more than 10%. Generally, experiments scored best on one item of performance bias, namely the degree to which learning was indeed more implicit in the implicit learning group than in the explicit learning group. In 14 experiments, the implicit group reported less explicit knowledge than the explicit group, while this was not the case for 9 other experiments. Descriptive synthesis. The tables give an overview of the main intervention effects for all experiments and comparisons made. Based on retention interval, we made a distinction between immediate and delayed retention test phases. We categorized different comparisons of learning interventions to discuss our main outcome values: absolute, performance, dual task costs, declarative knowledge. In order to show strong evidence for superior dual task performance due to implicit motor learning, we determined that the implicit group must demonstrate significantly better motor dual task performance and significantly less declarative knowledge compared to the explicit group. Finally, where possible, we also report single task results for each group comparison. This was done to check whether differences in motor skill level possibly confounded group comparisons in dual task performance. For instance, less skilled single-task motor performance may result in greater decrements in motor performance in dual tasks conditions. Immediate retention. First, we describe the results of the 13 comparisons of errorless and errorful explicit motor learning interventions. These comparisons concerned the following motor tasks: golf putting, rugby throwing, disc propelling, a surgical task, balancing, and table tennis. The dual tasks assessments consisted of tone counting, probe reaction time, random letter generation, and digit sequence recall plus kettle lift. 2 comparisons found significantly better motor dual task performance for the implicit group compared to the explicit group. 9 comparisons did not show significant differences, whereas this measure could not be obtained for 2 other comparisons. Cognitive dual task performance did not differ for 8 comparisons, whereas this measure was unavailable for the other 5 comparisons. For comparisons revealed significantly lower motor dual task condition for the implicit group. 6 comparisons did not show significant differences, whereas no motor dual task cognitive were available for other 3 comparisons. Second, we included 9 comparisons of analogy versus explicit motor learning. These concerned the following motor tasks: table tennis, balancing, and golf. Dual tasks assessments included counting backwards, digit sequence recall plus additional kettle lift or a tone judgment task. For 8 comparisons, significantly less declarative knowledge was reported by the implicit group than by the explicit group. Third, we included 6 external focus versus internal focus comparisons. These concerned the following motor tasks: table tennis, balancing, golf, and ball throwing. Dual tasks assessments ranged from counting backwards and tone counting to digit sequence recall. 2 comparisons revealed significantly better motor dual task performance for the implicit in comparison to the explicit group. The remaining 4 comparisons did not show any group. Cognitive dual tasking performance was similar across groups for all 6 comparisons. Delayed retention. First, we included 4 errorless vs errorful explicit instruction intervention comparisons. These concerned the following motor tasks: disc propelling, ball throwing, and balancing. Dual tasking assessments consisted of tone counting, counting backwards, and tone counting while kettle lifting. Implicit and explicit groups showed similar cognitive dual tasking performance in all 4 comparisons. 2 comparisons found significantly less declarative knowledge for the implicit than for the explicit group. Second, we included 4 comparisons of analogy and explicit motor learning. These concerned the following motor tasks: basketball throwing, table tennis, and balancing. Dual tasking assessment consisted of counting backwards, probe reaction time, and tone counting while kettle lifting. All comparisons revealed significantly less declarative knowledge for the implicit group. Finally, we included 2 studies that compared external with internal focus learning interventions. One comparison involved pedalo riding and one a balance board task. The dual tasking assessments were counting backward and a probe reaction time task. Both comparisons revealed significantly better single-task motor performance for the implicit than for the explicit group. For both comparisons, significantly better motor dual-tasking performance was evident for the implicit group. Combined, there are clear indications for superior motor dual-tasking performance for the external focus groups than for the explicit groups. However, because declarative knowledge was not assessed, it is unclear whether this superior dual-tasking performance could be attributed to implicit motor learning.